brothers, dear sisters, welcome, Urosh here. I would like to start this project Pursue Your Options with a video that explains the basic stuff about bleeding disorders. In many cases, knowledge is power, and that's why it's good to be educated about bleeding disorder, especially if you have one.
Time for learning. What have I not learned?
Bleeding disorder is basically a problem with coagulation of blood. Patients with a bleeding disorder, they bleed longer and they can also die because of it. The most known bleeding disorders are Hemophilia A, which is factor A deficiency, Hemophilia B, which is factor 9 deficiency, and von Willebrand disease, which is von Willebrand factor deficiency. Bleeding disorders are also divided into severity groups, which means that body can produce different amount of factor. For hemophilia, we know severe, moderate, and mild hemophilia, while in case of von Willebrand disease, we know von Willebrand disease type 1, type 2, type 2A, type 2B, type 2N, type 2M, and platelet disorder.
Life can be unkind, but only sometimes. You're giving up before you start.
Based on World Federation of Hemophilia data, hemophilia happens in hemophilia A in one newborn male per 10,000 newborn males. Hemophilia B happens in 1 per 50,000 newborn males, while von Willebrand disease is far more frequent. There are estimations that say that 1% of world population has von Willebrand disease. In case of acquired hemophilia, it happens in 0.5 person per million per year. Factors are proteins in our body that are, in case of hemophilia A and hemophilia B, produced in our liver. They are an essential part of coagulation process, so if our body doesn't build enough factor or the factor is missing, our process of coagulation is affected. But to easier understand how the coagulation process works, let us look at the following diagram. In the body of a person without hemophilia, when a blood vessel is injured, the walls of the blood vessel contract to limit the flow of blood to the damaged area. Then small blood cells called platelets stick to the site of the injury and spread along the surface of the blood vessel to stop the bleeding. At the same time, chemical signals are released from small sacs inside the platelets that attract other cells to the area and make them clump together to form what is called a platelet plug. On the surface of those activated platelets, many different clotting factors work together in a series of complex chemical reactions known as the coagulation cascade to form a fibrin clot. The clot acts like a mesh to stop the bleeding. In case of a person with hemophilia, things start to go wrong after the form of platelet plug when the blood initially even stops. If we are not having enough of one coagulation factor, the coagulation cascade is affected and consequently proper formation of fibrin clot. This leads into wound that is not properly closed, and that's why the bleeding restarts and doesn't stop.
I've seen it in communities, so many that it's hard to believe. Elders speaking wisdom far beyond what they choose to teach.
Hemophilia is nowadays treated with plasma and recombinant-based factor concentrates. We inject factor concentrates in our veins. Treatment that is nowadays used is prophylaxis and on-demand. Unfortunately, the majority of hemophiliacs still don't have the access to this kind of treatment because of the price of the treatment, and they are tremendously suffering and also dying. Many times I'm asked about the age when I got my hemophilia. For many patients with hemophilia, this could be a silly question, since everyone was taught that hemophilia is mutation of a gene and you are born with it. You can inherit it from your ancestors, or you can be the first one in your family to get hemophilia, which happens because of gene mutation. On the illustration you can see X and Y chromosomes. Hemophilia is transmitted with chromosome X. As you can see on this diagram, chromosome contains DNA. DNA makes up genes, and genes contains instruction for making proteins. To easier explain how you inherit hemophilia, I'm going to borrow a few great pictures from Hemophilia Federation of India. Please keep in mind that we inherit one chromosome from our mother and one from our father. In the first case, a patient with hemophilia has kids with a healthy woman, and the result is healthy sons and daughters who are carriers. In the second case, the mom is a carrier, while the father is healthy. This combination can result in a son with hemophilia, a carrier daughter, or healthy son and daughter. The last case that can happen is when a patient with hemophilia and a carrier falls in love and decide to have a family. Their combination of chromosomes results in a possibility of a healthy son or son with hemophilia. In case of daughters, a daughter can be a carrier or she can be a patient with hemophilia. Yes, girls can have hemophilia as well. I was a bit confused when I met the first one, since I was taught that this is not possible. Even having hemophilia myself, it's hard to imagine what a girl's experiencing, especially because of their periods. I know already a few extraordinary girls with hemophilia, and in the future I'll try to share their experiences with you. But there is one more way of getting hemophilia, and that's why the question about when did I get hemophilia is not so silly after all. This type of hemophilia is called acquired and can happen in adulthood when body starts to produce autoantibodies that attack and disable coagulation factor. We mostly bleed in our joints, so internally, but we can also bleed in our parts of our body and also externally. A few years ago at one of the World Federation of Hemophilia Congresses, I got from Novo Nordisk a great educational video about what is happening when you have a bleed in your knee. The video is so great that I would like to share it with you, so enjoy it.
Hello, and welcome to this interactive session on joint function in hemophilia. This is an animated guide which will take you into the knee joint to show you what actually happens during a bleed. We will showcase a healthy knee, review important information and facts on joint bleeds, show you the complications that can arise, and share ways to optimize therapy. Let's start with a brief overview of joint bleeds. Joint bleeds are the most common complication in hemophilia, accounting for up to 85% of bleeding episodes in patients. Bleeds can occur in elbows, ankles and knees, but knees are the most common. They can happen as a result of an injury or can happen without any type of injury. Joint bleeds usually begin by age 2, when the child begins to move around more often. Let's look first into a healthy knee joint. There are 4 main bones to the knee: femur or thigh bone, tibia, also known as your shin, the fibula, and patella or kneecap. The cartilage that surrounds the ends of the bones protects them from the constant friction of movement in that joint. There is a tissue that surrounds the joints called the synovial membrane or synovium. The synovium produces synovial fluid, which works to lubricate the joints and keep them working properly. The clear fluid allows the cartilage between the bones to slide back and forth without any damage to the joint. Normally, there is no blood in the joint space, and the synovial fluid gets replaced frequently to keep the joint healthy and functioning. Maintaining healthy cartilage and synovium is key. Now, let's look at what happens in the knee during an acute bleed. Joint bleeds can occur spontaneously or be caused by an injury. You can see the blood beginning to leak into the joint space. The bleed should be treated quickly, ideally within 2 hours. In case of delayed treatment, the synovium becomes inflamed as blood accumulates in the joint space and the joint begins to swell. As the blood accumulates, the body attempts to break down this blood to remove it from the joint space. The blood is broken down to waste products and iron. This waste and iron that are left behind is toxic to the cartilage, synovium, and bone. If the bleed is not treated quickly or adequately, the bleeding continues and creates an enlarged, painful, and eventually immobile joint. If this were the only bleed, the synovium would be able to reabsorb the blood over time and the joint would heal. However, repeated bleeds into the same joint cause a vicious cycle. And each time a bleed happens, the waste and iron accumulate in the joint, causing further damage and immobility. Some of the iron and waste products are left deposited in the joint space. This damaged joint is then more likely to bleed. Over time, the repeated bleeds cause chronic inflammation that has lasting complications on the joints. The accumulated waste and iron are toxic to the cartilage, bones, and synovium. As a result, the synovium thickens and grows tiny finger-like projections called microvilli. The synovium, with its small finger-like microvilli, are now more prone to getting pinched between the moving bones, resulting in a bleed. This early stage of joint damage where there is inflammation is called synovitis. As a result of this synovitis, the synovium no longer functions correctly. Thus, it is unable to lubricate the joint properly or remove the blood from the joint. Blood also has a toxic effect on the cartilage and prevents it from repairing itself. As this happens, the joint may form bony cysts with a loss of bone mass, leading to further pain and immobility. With repeated uncontrolled bleeds, there is more damage to the synovium and cartilage until the joint is unable to move. It resembles a crippling type of painful osteoarthritis, and the damage becomes permanent. The damage to joints caused by repeated bleeds gets worse over time, causing pain and reducing range of motion. However, there are simple things that can be done to actively look after the health of joints. By recognizing the early signs associated with a joint bleed, action can be taken to stop it. Pain, warmth in or around joints, swelling and stiffness are all signs to be aware of. Check joints regularly for any changes in how they move or feel. If you feel something, do something. When a bleed is detected, it is important to treat with factors as soon as possible. Early treatment means less blood in joints and fewer complications over both the short and long term. Besides treatment with factors, other options to treat a joint bleed can include protecting the injured joint from undue stress, resting the joint for at least 24 hours, applying ice for 15 to 20 minutes every 2 hours, compressing the joint using a bandage or compression stocking for the first 24 hours, elevating the joint. Treating bleeds early is very important. However, there are simple things that can be done to actively look after the health of joints and so limit the impact of joint damage. Lifestyle choices, such as keeping fit, maintaining a healthy weight, and being more aware of what activities help or harm joints, are all part of protecting joints from damage. Doctors, hemophilia specialist nurses, and physiotherapists have lots of different ways to help people with hemophilia keep their joints healthy for longer. This concludes the Joint Function in Hemophilia presentation. If you have any other questions, please talk to your doctor or hemophilia team. Thank you for joining us.
As you've seen in the video and you probably know by yourself, having a lot of bleeds is not good for us. That's why a fair question arises. What can we do to prevent those bleeds? In case of a bleed that happened due to an injury, we have to take better care next time, or we have to have stronger muscles that help to support our joints. But there is another kind of bleed that can happen, and it's called spontaneous bleed. We were educated that it happens just because it happens, but I found out that this is not true. Actually, I found out how to control those bleeds, but this is going to be the topic of new video, so be sure not to miss it and enjoy it till then. Bye bye.